Hi everyone, my name is Dr. Scott Stevenson, and I'm a small animal veterinarian in Gananoque, Ontario. I'm thrilled to have the opportunity to once again be a part of the efforts of the Canadian Veterinary Medical Association in partnership with Merck Animal Health to promote National Tick Awareness Month in March. This year, our theme is, what do you really know about ticks? Over the past 2 years, we have presented webinars during National Tick Awareness Month, which have focused on the range expansion of ticks, how to develop a clinical standard for tick-borne illness prevention, and discuss some of the challenges dealing with positive dogs. Last year, through the National Tick Awareness Month social media campaign, we consistently received the same questions. Clients want to know the basic facts about ticks. There's rampant misinformation on the internet, and not surprisingly, confusion with the general public when it comes to basic information about ticks, such as when ticks are active, what they look like, and where they can be found. We've decided this year we would like to focus on answering these basic questions. To do this, we have recorded a series of videos and created supporting social media tools, which can be found at the Canadian Veterinary Medical Association website at canadianveterinarians.net. In 2012, a paper authored by Patrick Layton was released predicting the rate of range expansion of Ixodes scapularis in eastern Canada. It was predicted that the leading edge of their established home range would progress northward at a rate of 46 kilometers per year. More alarmingly, it was calculated that approximately 18% of the human population in eastern Canada lived in an area where black-legged ticks were established in 2010. Based on the modeling predictions, by 2020, which is just 2 years from now, 80% of the population will live where these ticks are established. That means that in just 10 years, we've gone from 1 in 5 to 4 out of 5 people being at risk for contracting Lyme disease simply by going outside. Further, if this were true, it's likely that virtually all Canadians living in eastern Canada will travel at some point to an area where these ticks are established during the year. And in December of 2017, a paper was released by Katie Clow from the University of Guelph, whose results show that the spread of 46 kilometers per year is more or less consistent with exactly what we've been seeing in eastern Ontario. And I think overall, we as veterinarians, technicians, and veterinary assistants in clinical practice are becoming more comfortable with this fact that ticks are expanding their host ranges more or less across the country, whether that be Ixodes or dermacenter species. We know that the risk is increasing for our patients, and for the most part, we've adapted our behavior in practice to reflect this. What I hope we don't lose sight of is the importance of client education. In our clinic, we have successfully implemented what we call the three-pronged approach for our patients, which involves client education first, prescribing a tick preventive with label claim against the target tick species, and then vaccinating for Lyme disease. As a result, we have had great success in significantly decreasing clinical illness and seroconversion in these patients. As I've spoken about for years, we implement these steps in order based on an individual patient assessment of risk. For example, most of our patients are on the full three-pronged approach. But even in our practice in a hyper-endemic region, we have some patients who may not require all three. For example, a Chihuahua who uses puppy pads inside and is carried around in her mom's purse around town likely doesn't need a Lyme vaccine, but may still require a preventive to prevent an inadvertent flea infestation. Regardless of your location in Canada, there is some risk of your clients and your patients encountering a tick. Even in areas where tick populations are not yet established, they might be traveling to an endemic area or encounter an adventitious tick that caught a ride on a migratory bird to the area. Therefore, I believe at this time all clients across the country should be made aware of the very basic information about ticks, and we hope to provide that here today. Even in endemic areas where ticks are well established, it's easy to assume that clients know more than they do about ticks. Just because they've been around a while, we assume clients know what they look like, how they walk, how they look at different stages of engorgement, and what time of year they might be out. But this isn't always the case. Despite the fact that we've had black-legged ticks in our area in significant numbers for at least the last 12 years, I still spend the vast majority of my time with clients educating them about the very basics about ticks. The questions change over time, but they're still very basic in nature. This winter, for example, with the colder temperatures in January, clients routinely said, well, at least this weather will kill some of the ticks. And unfortunately, that's just not the case. The ticks live happily under the snow cover, and even if they're exposed to the elements, can live in ambient temperatures of -18 to -20 degrees Celsius, and the microenvironment that they're in under the leaf litter or under the snow cover rarely, if ever, actually reaches these temperatures. We have prepared answers to many of the most commonly asked questions we have received from last year's National Tick Awareness Month social media campaign, and those I have received repeatedly in my clinic. Our goal is to arm your clients with reliable information that is accurate to help facilitate discussions with you in your clinic. I firmly believe that we have not only the opportunity, but the obligation to help educate our clients about the risk to not only their pets, but themselves and their families as well. I believe that by doing this, we will help prevent illness in our patients and our clients, and ultimately strengthen their bond with your clinic. The videos are meant to provide simple answers to the most commonly asked questions in practice. Our goal is to keep the answers concise and to the point, such that each is between 30 and 90 seconds. We wanted to keep the client's attention and answer those questions that are commonly asked, but may not have readily available, reliable, accurate answers on the internet. Even as people become more and more comfortable with ticks being present in the environment, we find that clients are still generally confused about what time of the year they can expect to start seeing ticks. We also find that clients are surprised to find out that ticks survive the winter. The black-legged tick takes 2 to 3 years to go through their life cycle and happily overwinter under the snow cover. Our hope would be that these tools would be used as part of your clinic's social media campaign, or perhaps in your waiting area or examination rooms. Links to the videos could also be included in clinic newsletters or emails to clients. Our goal is that these videos reach your clients and provide answers to their questions that they may not otherwise discuss when they're in the clinic. Our hope is that this will stimulate discussion with your clients and help you better understand where a knowledge gap may exist. We hope that you find these helpful, and we certainly welcome any additional questions you may hear in your practice and any feedback that you have in general about this year's National Tick Awareness Month campaign.